whether it's dangerous for the Duggars to expect baby number 20 to what Joy should do about her acid reflux, a lot of our hot topics could use some professional help. So we've called in the doctors for a consultation, including Joy's cough. Please welcome OB/GYN Dr. Sherry Brasner, internist and author of The Acid Reflux Solution, Dr. Jorge Rodriguez, and therapist and co-host of the upcoming ABC show, The Revolution, Dr. Tiffany Davis-Henry. Welcome all. We have a lot to get through. I want to start with you, Dr. Brasner. Michelle Duggar just announced she's pregnant with baby number 20. Now, she's 45 years old. She had pre-eclampsia during her last pregnancy and actually had her baby 3.5 months prematurely delivered. What is pre-eclampsia, and is it dangerous for someone who has had it in general to get pregnant again?
So pre-eclampsia is a disorder unique to pregnancy, and it can affect just about every organ system. Heart, lungs, central nervous system. It can cause seizures, kidney dysfunction, liver disease. So it's pretty serious, and its treatment involves delivery of the baby. So while I don't take care of Michelle, the idea that she was delivered 3.5 months early means they were very worried about her, because your first choice is never to deliver such a premature infant. The recurrence rates for preeclampsia in the next pregnancy are linked to how severe the symptoms are and how early you had to deliver them. So I'm very worried about her next pregnancy.
Is it at what point, I mean, outside of the Duggars, because baby number 20 is not something we hear about quite often, at what point does a physician become concerned about the number of children a woman has had?
Well, it's not specifically the number. We don't have any outcomes that by themselves have been shown to be linked to the number.
Okay.
But everybody's older when they're having, let's say, baby number 7 or 8 or number 20. And so most of the risks are going to be related to her age. And those by themselves, she's 45.
Yeah.
And so even if she gets over the hurdles of early miscarriage, I mean, even getting pregnant, she is looking at risks of high blood pressure, gestational diabetes. Age is uniquely related.
Is there a point where you would say to a woman, and stop it, that's enough?
Well, I have to assume that in her last pregnancy...
I would. I'd say you shouldn't do it anymore. That's it. I mean, after 15, stop it.
What about psychologically, Dr. Davis-Henry? Is there...
The thing is, you can say stop it, but whether they choose to do that is a whole nother...
Right. And so we have to respect the individual's decision. I would hope that she was counseled after that pregnancy to understand that she was at incredible risk going forward.
But she's got another one coming, so she obviously
But
didn't...
it's not over yet, so I'm hoping that it has a happy ending.
All you can do is hammer it home. Like if you have somebody that you know is an alcoholic at the office,
Yeah.
I mean, what are you going to do, stop seeing them? Somebody has to be there when they fall, right? So
She seems to handle the kids quite well from what I can see. Dr. Rodriguez, I want to move on to another problem that's specific to Joy. And a growing number of people, you're not alone in this, are complaining about acid reflux and heartburn. Are they the same thing, and what's causing it, and how do you actually prevent it or treat it?
Great. First of all, you're not alone. You're not alone. There are like 50 million Americans that suffer at least once a week from heartburn, which is the symptom. You feel burning here.
I don't have heartburn.
What do you have?
I just have clearing my throat.
All right, that could be a symptom of that. Acid reflux, and I don't even like to use the term acid. It's actually reflux. It's the stomach contents coming up into the esophagus, or sometimes even higher into the throat. Do we have the graphic up there?
Yeah, we have an animation here.
So, Joy, up to 1/3 of everybody with asthma, it's because the acid comes all the way up and then comes down. So, what usually happens is the stomach contents right here. There we go. If you eat too much, or if you eat late at night and then lie down, it's very easy for these contents to come all the way up here. Yeah. Sometimes even higher. The sphincter, the lower esophageal sphincter, should naturally be stopping that.
The sphincter? How low is that?
Well, there's a sphincter. There's actually... I was going to go there.
Yeah,
there's actually a sphincter that's even lower.
Okay.
All right, but that has nothing to do with this.
I'll tell you,
is your sphincter not working properly? Let's stay on the sphincter here.
With me, it's like I just ate shrimp. That's all I ate, and I have it. I just ate yogurt for breakfast, and I have it. I'm not overeating. I'm not eating at night.
Okay, so what do you do about this?
What you do is, first of all, you may need... Do you take antacids every day?
No, I don't take them at all.
All right, so you may have hypermotility, which means that your stomach is actually moving things up as opposed to down. There are medicines that control that. Sometimes if you don't, you seem to be doing all the right things as far as habits, you may have no other choice but actually for somebody to tighten your sphincter. Seriously.
Stop
with a laparoscope. Someone you know.
Don't volunteer for it, okay?
No, there's...
Sphincter under control, Joy. That's what we are leaving with us.
There's a laparoscopic test. I mean...
You can tighten your sphincter with what?
With what? With a suture. They go in there with fiber optics. They put a little suture on it.
Go for it.
It tightens so that things don't come up.
Oh, that's interesting.
Because you don't want that coming up.
I don't.
No, it erodes your esophagus. It can lead to bad things.
Go lower and then come up from there.
We'll schedule you guys an appointment together after the show. One thing that did come up quite often in recent weeks is the Kim Kardashian-Chris Humphries divorce. In terms of, you know, they talked a lot about not knowing one another beforehand, allegedly in the reports. What are the basic things that couples should actually discuss before they get married and tie the knot?
Okay, so there are plenty of things that we need to discuss. Obviously, one's relationship with money, finances, how we handle stress, work ethic, children. Do we want to have children? How do we raise children? Family, negotiating conflict. All of those things are really important to discuss before. I actually think that they did have some of those discussions. I don't think that they really listened and believed what they were hearing.
Is there an app for this? Like, can we download, like, okay, here are the things we got to talk about today? Check. We just talked about money. Because I think having an objective sort of neutral way of bringing it up helps.
Yeah, and I think those things... I watched the show. I'm a reality TV junkie. So I watched the show. What I saw was those things were discussed. Those things were laid out there. Okay. But I don't think they really listened to each other. When someone says, you know, I don't feel comfortable in this situation, or I don't like this, or I don't want to move here, or I don't want to do that, believe them. Okay. There's no reason
people are saying that Kim is addicted to publicity, to attention, to love. Is that true?
Well, you know, I don't know
her, but... Is there such a thing
but
as being addicted to publicity?
I don't know that she's addicted to it, but I certainly think that she thrives on it, like most celebrities do. I mean, why do it? Why be in this business if you're not going to thrive on the attention?
Some people do it because it enhances their career. Other people need it. It's different.
Yeah, I think she's certainly in love with the idea of love and in love with the idea of being married, and, you know...
We want to move on to something which has been actually in the news as well. The HPV vaccine, Dr. Brasner, has been given to girls, right? But it just, as of, I think, a couple weeks ago, is now recommended that 11-year-old boys should start getting the vaccine as well. What are your thoughts on this?
Well, I am in favor. My daughter was vaccinated when she was 12. Her twin brother hasn't yet been vaccinated, and I've polled a lot of the pediatricians. The response to the Gardasil vaccine wasn't quite what we thought with young women. Right. So in order to bolster some of the effects and get true herd immunity and really help reduce the risks of both genital warts and cervical cancer, we want to engage young men, since it is a sexually transmitted infection.
Was it a mistake that they didn't introduce that right from the jump?
You know, I think it was felt that they were going to get enough of a bang for their buck if enough girls were signed up, and we just have really missed the mark. It's a safe vaccine. It really now, may show reductions in anal cancers as well as some common head and neck, like mouth and throat cancers.
So should it be mandatory, do you think, for girls in particular?
I fall short of thinking that other organizations should mandate. I think that there should be strong...
Isn't the DPT mandated? You can't get into school without it, so why not this one?
Yes, but those are a true public health crisis. This, I think, can be handled on an individual level, and there are a lot of other, strategies for reducing risk. I mean, I gave it to my daughter, but I think I would feel a little uncomfortable with someone saying she had to have it.
Okay.
Well, I'm kind of pro what Joy's saying. I'm sorry to interrupt. And I think because, you know what, it saves lives. We keep mixing all this sexual, social stuff into it. If you had a daughter and you could prevent her getting cervical cancer, I think it should be mandatory and parents should be able to opt out.
That's how I agree with that.
I'm wondering why we're focusing so much on girls and not boys.
Yeah.
Girls are,
boys too.
Yeah, they both need this vaccine. Sure. It's not unique. Cervical cancer certainly is unique to women, but little boys are carriers of HPV as well, and I don't understand why we wouldn't want them to have access to the same vaccine.
A great discussion, as always. Our thanks to Dr. Brasner, Dr. Rodriguez, and Dr. Davis Henry, who will be co-hosting the new ABC show, The Revolution, starting in January. Congratulations. As always, please consult your personal physician for medical advice suitable to your circumstances, and we'll be right back with Lawrence Fishburne.